In this video, we're going to be talking about range of motion, specifically through the lens of you having back pain or sciatica and working on a rehab process, the earlier parts of that, and then the latter parts, which will be essentially working out in a back-friendly way, and how range of motion comes into all of this, because let's face it, it can be confusing. There is lots of different information. There's full range of motion, there's half range of motion, there's what about the pain? Should we push through the pain? Should we not push through the pain? Let's be real, it is very confusing and there's lots of different stuff, and let's first just clear the water by identifying who are you. Part of the confusion around these sorts of topics, range of motion in particular, is that the video that you might see, this one or others, doesn't necessarily identify who this advice guidance is targeted. You'll get people that talk about half range of motion that's saying full range of motion is terrible, and you'll get the exact opposite without actually distinguishing that certain people, certain issues, and certain rehab protocols or strengthening protocols or exercise protocols need to be geared towards the individual that is partaking in them and not someone else. For the sake of pinning that down first, you are someone with a back injury. Maybe you've got a disc bulge, maybe you've got a minor back issue, maybe we've got some degree of sciatica, but we are recovering from that injury and we're doing a sensible rehabilitation process to take us through that process. And that's where, considering range of motion, it's through that lens that this video is really going to help you better understand how to understand range of motion and how to employ it in a changing way through a program. And of course, this video is not for you if you're in the gym lifting 100 kilos and looking at how range of motion can play in there. Very different set of circumstances. Now let's get into it. Fundamentally, we want to aim for full range of motion. That's very, very important. But when you've got back pain and you're starting some of those early rehab processes, strengthening exercises I'm talking about here, it might be that you don't have the strength to properly and competently do a full range of motion exercise. So what do? Do we just throw it out of the window? Well, most of these exercises are going to be maybe body weight or partial body weight exercises to begin with. And we need to face the facts. If we can't do full range of motion without the hips, maybe we've got some dodgy hips, maybe we've got some injured knees in the past, and they're getting a bit grumbly whilst we're doing some of these exercises, it's no use aiming straight away for full range of motion. Don't beat yourself up about this. Of course, doing full range of motion exercises is going to be the best for us. It helps us learn to move our spine, move our body through certain ranges of motion that are akin to daily activities. For example, if we don't have good hip and knee mobility, then we're going to struggle to effectively sit down on the toilet seat without rounding our back and causing trouble in the early days of recovering from back pain. And long term, if that action of sitting down and getting up, dinner table, out of bed, out of the chair, is one that doesn't use full range of motion in the relevant joints, ankles as well, then we're going to get into trouble because we're going to be doing repetitive tasks that are putting strain in incorrect areas of our body. Quite often it's this lack of good range of motion that has been a factor that's led to the back pain in the first place. We did a recent video asking you to consider all the different things that could have led to your back problem and how long they may have been a factor. And one of those things would be, how long have we got these bad habits? Because we don't have competent full range of motion in certain joints, we are repeatedly putting extra strain on our lower back when that strain should be taken up by these more competent joints such as the hips and such as the knees. But where they become painful, we tend to shy away, and that's another big issue. What about the pain? It hurts my knees, it hurts my hips, etc. when I go too deep on a squat, for example, because it's such an easy one to identify with. The benefits of doing a squat like this over a squat like this over here are manifold. You've got benefits on the joint health, you've got benefits on the muscles, you've got benefits on the ligaments, tendons, all these sorts of things that come into play when we move properly, not to mention circulation as well. Taking these muscles through a full range of motion as well as they move that joint through a full range of motion, that's from full stretch to full contraction, really helps them function well too. And when we think about a lot of people with back pain getting stiffness and all these other sorts of things, it's very frequently associated with a lack of movement and normal movement. The reality is that doing full range of motion actually does require an awful lot of competence. And if over the last couple of years, months or longer, you haven't been doing full range of motion exercises, it's going to take a bit of time for you to build into that. And that's why it's so important you don't aim for full range of motion straight away and beat yourself up about that, because the ligaments, the tendons, the muscles, the joints, etc. are all going to have to adapt to maybe 50% more range of motion is what you really need to be working towards what's capable and possible for you. And that's going to take some serious adaptation. And more importantly, that's going to take some time practice, and perseverance. So we've discussed range of motion, we've discussed all those things. Now we're going to go through 5 steps, 5 things that you can do or that will help you start to get into this and work towards a full range of motion in a sensible and safe way. Step number 1, videos help. How on earth do you know how far you're going down or up, whatever the exercise may be? If we just take the squat because that's the easiest example that we mentioned earlier. How do you know how far you're going up and down if you don't record it? How do you know what you were doing a week ago, 2 weeks ago, 3 weeks ago if we don't record it? Chances are, we know that most people that are watching these videos are watching them on their mobile phone, most of which have a camera. Get your camera out, prop it up with some books or on the kitchen table and record yourself. You don't need to share it, you can do, but you don't need to share it, but it's for your reference and that allows you to measure things. Quite often people go through having back pain for such a long period of time and they don't ever get down to fixing it because there's a lax approach to actually fixing it. We're not taking measurements, we're not really investing in the discipline required to measure these things and see progress over time. It can become quite consuming. You adapt to the new normal. As you get better, that becomes the norm, and it's not good enough, but it becomes the norm, and it's sometimes really helpful to just look back and go, hey, I couldn't even do 10%, 20% of a squat 6 weeks ago, but now I'm doing 30 or 40%. Well, it's still not where you need to be, but it's a significant improvement on before. And if you don't have those videos, you can't compare. And that leads to a bit of demotivation, which often is why people give up with a program because they don't see the progress. And sometimes you need to make more progress than you realize in the exercises to get to a point of being pain-free. So you got your video out. And you'll go, what are we going to record? We're going to record our first one, which is a good form exercise with our allowable pain-free range of motion. How far can we go pain-free and with good form? We don't want to change our form, cajole our body into getting into the greater range of motion. We want to do it with good form, compared to what we should be doing, and record that as our starting point. Maybe a front on shot, maybe a side on shot, whatever the exercise may be. Step number 2, we want to actually validate that form. We've got the recording, we look at those two compared to what we should be doing and compare and contrast. Make sure that it is in fact good form. And maybe you've got 1 or 2 videos there which you've gone a little bit far and your knee started to hurt or the hip started to hurt or the back started to catch and you know that, okay, that's too far, so that's not appropriate. So the next one is practice, practice, practice. Maybe you're doing your exercises every day, maybe you're doing them 3, 4, 5 times a week. You're gonna practice. You're gonna practice that good form, getting comfortable, start to challenge those muscles, ligaments, tendons, do the workouts, make the progress through the relevant program. That's number 4. Now, as we're going through number 4, we're steadily trying to increase the range of motion, and that is the way we should proceed. Number 5 is a little bonus tip, and that is, let's suppose you're doing 3 sets of 10, for example. You might do all of the same reps at 25% range of motion. You're going to do 3 sets of 10 at 25% range of motion. Well, how can we take a little bit of progress, test those boundaries a little bit? What we can do is the first set, we can go a little bit deeper, maybe 10% deeper. And then the second set and third set, we can do our normal reps. And steadily over time, we can go from the first set being the only one that's a little bit deeper to the first and second set, and then the first, second, and third set. And that might take place over a couple of days, a couple of weeks, a couple of months. It's really down to you and the progress that your body is happy making. There's a whole host of other things we want to consider: fueling, rest, recovery, all those other sorts of things. But if you're following the exercises and progressing in that manner, you will make incremental improvement. And then of course, we're going back, we're taking those videos again. This way of doing things allows you to incrementally increase those reps and the range of those reps. It's important that we give our body time to adapt, the muscles time to change, heal, get stronger between sessions and over the course of the coming weeks. And that will really help you safely increase your range of motion. It's okay here to start with those reduced ranges of motion, and we're aiming towards the full range of motion because that is what is going to keep all of our joints, our back in particular, healthy and happy for the long term. And it'll probably mean that you are an awful lot more fit and in shape than you were before you had your back pain. So one final thing is just kind of a little afterthought. We mentioned earlier on in this video about considering you. Who are you? What's going on with your particular circumstances? Things like if we're awaiting a hip op next week, or if we've had a knee operation or cartilage work done in the knees. These these sorts of things will feed into what range of motion is possible or necessary for you. And of course, please consider those things, discuss them with your relevant surgeons or physicians, as the case may be, to ask them, hey, I've just had this operation, or I had it 6 years ago or 3 years ago. What is a reasonable, safe range of motion that I should be aiming for? Because my current range of motion clearly is not doing me any favors when I think about my lower back. So just bear that in mind if you are someone who falls into that category or something similar. Hopefully you found this video helpful. Hopefully those 5 points give you a solid framework to help you have more success in your current rehab process, and you understand better how to improve your range of motion and what to aim for. If you did find it helpful, give us a thumbs up. Consider subscribing to the channel so you don't miss any future videos. We tend to release one every single week. And consider sharing this with someone else that might be struggling themselves. Until then, we'll see you in the next video. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.